Hi guys, welcome back. Thanks for tuning in to our Back to Health live special. My name is Max. I'm a physical therapy aide at Ocean Avenue facility. And we have Dr. Alex, who's about to give you a speech about a knee.
Hey guys.
You ready?
Yeah, sure. Hey guys, welcome back to Tuesday Night Tips with Back to Health. My name is Dr. Alexander Diktarov. So today we're going to be talking about saving your knees. Basically, a lot of the times when we're exercising, when we're doing things around the house, we tend to put a lot of pressure on our knees and ultimately can cause damage. So we'll go through a couple of things on basically when you're exercising, when you're doing things at home, just to be a little bit more careful so not to hurt yourself. So we'll just kind of go through a few structures. What's a knee? We have a nice, beautiful picture right here. So simply put, you have a nice long bone right here. This is your thigh, also known as your femur bone. On the bottom, it's connected to your tibia bone. And on the side, you have your fibula. The big three bones of your knee consist of your femur, your tibia, and the little bone right here, also known as your patella. So this is your bone structure. Now you also have, if you look right here, we have 4 ligaments that support the knee, which is your ACL, your PCL, your LCL, and your MCL, which I'm sure you've heard, whether you're on MRIs or a lot of people talking about, my MCL sprain or my ACL sprain or tears. Basically, they're talking about the ligaments that support you when you're moving from side to side, when you're going forward or back and forth from basically your knee buckling and obviously you falling. Also in between right here, we're gonna look at, let's see what's a good picture. So right here we have between the femur and the tibia, you have 2 structures known as your meniscus, which I'm sure a lot of people have heard. So the part of your inner thigh, that's your medial meniscus, and the outside is your lateral meniscus. It is basically serves as a cushion for the knees. So when we're walking, it absorbs the shock, our body weight. Excuse me. Every bone, let's see if I have a good picture right here. So right here, we have every bone has cartilage around it, and it serves to protect the bone. And ultimately, the cartilage is in contact with the meniscus. When either one of those structures is damaged, this is when we have knee pain. And ultimately, what we're talking about today is how do we preserve our cartilage from getting injured and from meniscus tearing or getting hurt. Okay, so some of the kind of facts I'll just mention real quick. Whenever we're walking, I apologize, when we're doing exercises, when we're bending, ultimately our meniscus takes about 85% of our body weight, especially when we're squatting incorrectly or when we're shifting from side to side. Our ligaments play a lot of role. They have to be supporting us, obviously. And in terms of meniscus, whenever, let's say, you shift from side to side, so just nice and simple, if you're shifting, the pressure on your lateral meniscus or the medial meniscus takes on about 2 to 4 times your body weight. So again, it's important to keep your knees and your meniscus nice and healthy. Back in the day, whenever we're talking about before 1970s, whenever your meniscus would get injured, ultimately the doctors would take out your meniscus, whether it's your medial or your lateral, and about 300 to 400% of the body weight would go on the meniscus that's in your body, which is a lot of strain. Our meniscus not a lot of blood supply comes to our meniscus, especially the inner part, the outer part of the meniscus. I have it right here. So basically, the outer part has a little bit of the blood supply coming through, so it can still heal depending on the grade of your tear, but the inner part are unlikely to heal. This is where the surgeries come in to either shave the meniscus instead of removing it. This is a more modern surgeries. Okay, so anyways, we're gonna just kind of jump in. I'm gonna have Max assist me with a couple of exercises. Just to your typical thing, right? You go to the gym, you watch some people working out, you hop on the leg press. This is the leg press. So do you mind hopping on? Sure. And you start working out, and this is where you want to avoid getting injured. Your most kind of common injury is from working out incorrectly or from doing your basic things like squatting down, which again we're going to show you. So typically, right, when people kind of get on this machine, they'll usually do something, you know, kind of put their feet somewhere in the middle, and they'll just start pushing down. Or actually, this is going backwards. And then you can come back in. So if you look, his knee right now, well, this is not too bad. But, so, sorry, let me just guide you through. So this would be like a wrong way of doing that leg press, because when your knee ultimately goes past your toes, you're compressing a lot of your meniscus. Once the meniscus gets compressed, again, this is where a lot of the injuries happen, especially when you're not on a machine, when you're like in a dynamic motion. You add a little twist, you can tear the meniscus. So the more proper way of doing that, you want to keep your feet a little bit higher, so your toes have to go past your knees. Now you're pretty much creating about a 90-degree angle or so, and you're not ultimately compressing the meniscus. So go ahead and do a... You see, like, again, you see here, like he's locking out. You don't want to be locking out. You always want to have your knees slightly bouncing, because you want to have your muscles working, not your ligaments or straining basically your structure. So you're going to come in, nice and easy, and you're going to come out. Good. You can come out a little bit more, but basically you just don't want to avoid locking the knee joint itself. Awesome. Coming off. My favorite is the squat. Seeing the guys at the gym, or even somebody picking up something on the floor, and the way they squat, it's like, oh my God, you know, you're gonna get hurt. So here's your typical squat, right, that we see at the gym. Somebody that ultimately does not know how to work out, first time in the gym, or they see somebody else doing it and they're trying to imitate it. This is what they usually see. Again, kind of, if you come down and just freeze, obviously nobody freezes. The back is off, and again, we're looking at, you know, the knees are too much forward, right, where everything right here is getting compressed. Now, any kind of movements right here, you're ultimately putting a lot of strain and putting your meniscus at risk for tears. So we're gonna come up, and I'm gonna ask Max, just be careful, come forward a little bit. You're gonna just squat down, but we're gonna do it more correctly. So now you're getting this nice kind of back straight, nice, ooh, look at that. Nice angle, and his knees back up. His knees are not going past his toes. Now you're getting his muscles working instead of ultimately compressing the structures of the knee. So, simply put, you can just give it a try at home. Nice and simple. Just do like a little squat forward. You're gonna feel more pressure on your knees than in your muscles. And then you do kind of one of those backing up, where you're actually keeping your knees behind your toes. You're gonna almost instantly feel, ooh, I feel this nice little burn right here in my muscles, which is exactly what you should be feeling. Not, ooh, I feel the pressure in my knees. Because, ooh, I feel the pressure in my knees, this is how you pretty much end up in your doctor's office or in our office. And, ooh, I feel a nice burn. This is how you stay out of our office. Another one, and basically your lunge. Or you can take this, you can apply this with walking up and down the stairs. You could take this with any kind of cleaning or reaching forward. So basically, how most people, you know, do this lunge, or when they're trying to pick something up, right? Again, if you look at the knee right here, so just come up, but keep the knee right here. The knee is going past the toes. That's a big no-no, right? Right. So again, when they're kind of leaning forward, they're using their right leg. What they're supposed to be doing is using the left leg to come down. Okay, again, we have this nice 90-degree. This knee does not go past the toes, and that's a more proper way of doing the lunge. So again, when the right leg is in the front, you're not leading with the right leg, you're ultimately using the left leg to bring you down, not the right one. Awesome. Again, this video is going to be nice and short. Rafaela, show me. Oh, there you go, of course. What we usually say, and of course I forgot it today, please, any comments, any suggestions, what do you want to see next? Any questions? Definitely been getting questions, which I love. Kind of keeps me going. Ask questions, why we're doing this, why did you do that versus this? Well, you know, anything that comes to your mind, ask us questions. We'll be happy to answer. Leave comments, please leave comments. Definitely like to hear what you have to say, share. Please share the video. The more you share, the more we can spread this basic information, but we can save, a lot of knees. Hence the topic of today's tips. So again, thank you for watching. See you next week, and share and like us.